Autoimmunity involves the body attacking its own tissue proteins. This occurs because heavy metals, xenotoxic chemicals, or stealth pathogens attach to body proteins or enzymes, eliciting an abnormal foe response, marshalling the T killer lymphocytes to destroy potential enemy proteins or enzymes. There's three issues to deal with in autoimmunity reduction. Eliminate toxins, heavy metals, and stealth pathogens. Then clear all secondary free radical singlet oxygen, hydroperoxyl radical, and nitroperoxyl radical, and cytokines released by angry macrophage and activated T killer lymphocytes. And the third phase is tissue rebuilding with biomolecules, hormones, and hormone precursors to support stem cell regeneration. This requires an abundance of bioavailable nutrients, minerals, amino acids, fatty acids, and signaling via telomeres to activate mRNA production in the endoplasmic reticulum outside the nucleoplasm of new regenerative structural proteins and enzymes. If all three phases are accomplished and continue to be supported, and inciting allergic signals that incite destructive immune behavior and free radicals, autoimmune abates and the person can heal. Curcumin, found in turmeric, has a long history of use for numerous health conditions. Curcumin inhibits these autoimmune diseases by regulating inflammatory cytokines, such as interleukin-1 beta, interleukin-6, interleukin-12, TNF-alpha, and INF-gamma, and associated pathways in immune cells. Typical doses of curcumin can range from 1 to 5 grams per day. However, due to its low bioavailability, it should be consumed with either biopterin, which is a black pepper extract, or else taken with a fat such as coconut oil, butter, ghee, or fish oil in order to increase its absorption. Resveratrol is found in tiny amounts in red wine or the herb Japanese knotweed. Anti-inflammatory, antioxidant, and anti-aging properties of resveratrol have been reported, and in some animal and human studies, this compound reduced and ameliorated the progression of autoimmune diseases, such as rheumatoid arthritis, systemic lupus, psoriasis, inflammatory bowel disease, and type 1 diabetes, to name a few. Typical doses are 500 to 1000 milligrams per day, taken in the form of trans resveratrol. There's also data to suggest that resveratrol consumption may lead to a 7% increase in lifespan. There's other supplements that show even higher capability of extension in lifespan, such as olive oil, and the most promising compound being charcoal. The use of charcoal supplementation is very interesting, as it implies one of the most important factors to life extension is the removal of toxins from the body, and indicates nutritional status and nutritional supplementation may not be the most important aspect of health and longevity. Charcoal could be very beneficial for an autoimmune condition, also as toxins are indicated in the pathology. Typical doses of charcoal are 500 milligrams of activated charcoal taken first thing in the morning on an empty stomach at least 2 hours before food. You can see my other video on DHEA, berberine, and growth hormone for another way to potentially extend your lifespan. Glutathione is considered the body's master antioxidant, and we know that you need it to dampen autoimmune diseases and lower your risk of developing new autoimmune diseases. Glutathione works by protecting energy-producing factories inside the cells called the mitochondria. Healthy glutathione recycling is also a vital tool in managing autoimmune disease. Glutathione recycling helps to repair leaky gut and protects it from permeability. Leaky gut can lead to or exacerbate autoimmunity, multiple food sensitivities, and chronic inflammation. There's numerous ways to increase glutathione levels, such as supplementing with reduced glutathione at up to 1 gram per day, taking N-acetylcysteine at doses of 500 milligrams 3 times per day, taking the herb milk thistle, eating asparagus, and correcting any selenium deficiency by consuming 200 micrograms per day or by eating 3 Brazil nuts. The supplement, oral S-acetylglutathione, when dosed at 200 milligrams per day, was compared to an intravenous dose of 1,400 milligrams, and it was found to be superior. Therefore, I'd recommend S-acetylglutathione as well as N-acetylcysteine and selenium for the best results. A lot of times people use the amino acid L-glutamine because it increases the support of your immune system and it decreases intestinal permeability. It's often supplemented when someone has leaky gut or an intestinal autoimmune disease like Crohn's disease or celiac disease. One other immune boosting formula for leaky gut is enzymatically preserved colostrum due to its high immunoglobulin content. Research and clinical experience has shown that some patients with autoimmune disease have significantly altered intestinal environments, particularly those with autoimmune conditions involving the gut, such as inflammatory bowel disease. And the addition of probiotics may indeed help to reduce these symptoms. The most effective probiotic mix that I know is called VSL3. You could also consume fermented foods such as yogurt, kimchi, kombucha, kefir, and sauerkraut. Prebiotic fiber can also help to balance and feed your good probiotics. You could also adopt a Candida diet and use Candida supplements to help eliminate a Candida overgrowth that is implicated in autoimmune diseases also. You could check out my video on Candida for more information about this. Vitamin D deficiency is known to be related to the development of autoimmune diseases. In particular, vitamin D deficiency is related to the development and the severity of rheumatoid arthritis. You can get a 25-hydroxy vitamin D blood test and then supplement accordingly to correct any deficiency with vitamin D3. High-dose vitamin C therapy is a powerful anti-inflammatory, and it's used for people that have chronic autoimmune diseases, infections, and even cancer. High-dose vitamin C may be given intravenously or orally. If you can't get intravenous vitamin C, the best oral form with comparable results is from liposomal vitamin C. You can learn how to make this cheaply and easily at home in an ultrasonic cleaner. Vitamin K plays key roles in different physiological functions, such as blood coagulation, bone metabolism, and the regulation of some enzyme systems. It can also act as a cofactor for some plasma proteins, thereby affecting immune and inflammatory responses, particularly mediated by T cells. There's evidence that vitamin K2 supplementation reduces inflammation in rheumatoid arthritis by reducing CRP levels. Vitamin K2 may induce apoptosis in rheumatoid arthritis synovial cells also. Dr. Weston Price, who studied traditional diets, labeled vitamin K2 as activator X due to all of its potential benefits to health and longevity. Typical doses range from 100 to 300 micrograms per day of vitamin K2, the best form being MK7. Zinc has protective effects against autoimmune conditions in which the body starts attacking healthy cells. Zinc is needed to trigger the activation of infection-fighting T cells. These control and regulate immune responses and attack infected or unhealthy cells, helping to ward off infection and disease. T cell function is highly zinc dependent, and this mineral is needed for their transformation into either killer cells or helper memory T cells, which help the immune system to remember a given pathogen should it encounter it again. Zinc also fights infection by subtly reining in the immune response to stop it spiraling out of control and causing excessive inflammation in the body. Typical doses of zinc can range from 30 to 50 milligrams per day, but be sure to get a bioavailable form, as many forms of zinc have poor bioavailability. Zinc's absorption is enhanced when taken with the bioflavonoid quercetin, which is naturally found in elderberry juice. This flavonoid also enhances the effects of vitamin C. GLA, or gamma-linoleic acid, is found in borage oil and in evening primrose oil, and it reduces inflammation. Some studies even suggest that GLA protects your DNA. The body converts much of the GLA taken in as a supplement to a substance called DGLA, and this is what fights the inflammation. A typical dose of borage oil is 1,000 milligrams taken 3 times per day. I've personally found this very effective in reducing the inflammation that comes from psoriasis. Nascent iodine may be beneficial if your autoimmune is also related to a hypothyroidism. However, it may make matters worse if you're suffering from a hyperthyroidism. You can check out my videos on hypo and hyperthyroidism for more information about this. A magnesium deficiency may cause increased production of inflammatory chemicals in the body, raising your inflammation, contributing to autoimmunity. Most people are deficient in magnesium. The best form to take would be magnesium bisglycinate. You want to start slowly and increase your dose until side effects such as diarrhea or stomach discomfort are noticed. Then gradually reduce the dose until you determine your maximum tolerable daily amount that doesn't cause any of the side effects of stomach discomfort. As magnesium is required by over 300 processes in the body, it can have profound benefits after a few months of supplementation. Taken in a supplement or food form, omega-3 fatty acids have been found to reverse the progression of a number of inflammatory diseases, from inflammatory bowel disease to diseases of the skin and the joints, and other autoimmune diseases such as lupus and multiple sclerosis. Typical doses of omega-3 are 3 to 9 grams per day of a molecularly distilled EPA-DHA fish oil blend. Beta-glucans, found in some medicinal mushrooms like the reishi mushroom and also found in oats, appear to act as an immune system modulator, and they may also help autoimmune diseases. As well as eating more oats and mushrooms, you can get supplements of purified beta-glucans. It's been established that the complex integrated immune system needs multiple specific micronutrients, including vitamin A, D, C, E, B6, B12, folate, zinc, iron, copper, and selenium. And these all play vital, often synergistic roles at every stage of the immune response. When supplementing, make sure to use a quality multivitamin with B12 in the form of methylcobalamin and with folate in the form of 5-methyl tetrahydrofolate, a non-synthetic form of iron, a yeast source of selenium, a mixed tocopherol form of vitamin E, vitamin D in the form of D3, vitamin K in the form of K2, MK7, and carotenoids from food sources. Cheap synthetic vitamins may not only be useless, but some evidence seems to suggest they can negatively impact your health. MTHFR mutations are relatively frequent in populations. Roughly 11% of people have this. The MTHFR mutation is also believed to predispose a person to certain cancers, birth defects, and autoimmune diseases. Every cell needs adequate methylation for its normal growth and repair. Methylation helps the body to detox and eliminate potentially dangerous substances. Proper methylation is particularly important for the brain and the neurotransmitters that influence your mood. How this basically translates to your health means if you're an under or over methylator, you require different nutrients and should abstain from some supplements. You can find a list of mental health symptoms associated with both under and over methylation, and this can help you to easily determine if you're on either side of this imbalance. An example, under methylation is associated with a wide range of physiological and psychiatric disorders like migraines, allergies, sleep disruption, mood regulation, memory problems, depression, and schizoaffective or bipolar disorders. But this can easily be treated by taking a multi-B vitamin and also, on top of it, taking B12 methylcobalamin at 5,000 micrograms per day, taking a folate as methyl tetrahydrofolate, and taking sulfurous compounds like DL-methionine, trimethylglycine, and MSM. The MTHFR gene polymorphism is also a factor that can increase toxic burden on your body, increasing the damaging products of homocysteine and the stress hormone cortisol. Other toxins are also implicated in immune dysfunction. You can see my video on mercury amalgam filling for more information on other possible sources of contamination, and on candida for the toxins that can be released from yeast overgrowth. Also, leaky gut, which can interfere with gut permeability, allowing toxins in the food to enter into your bloodstream. You should start to eliminate artificial sweeteners and flavor enhancers like aspartame and MSG. I've shown more information on the damaging effects of these in my polymyalgia, fibromyalgia, and chronic fatigue videos. Chemicals like BPA, bisphenol A, found in plastics can contribute to autoimmune disease. In my video on the menopause, I show a link between using non-stick frying pans triggering earlier menopause. Some of the most effective detoxifiers have already been discussed here, being glutathione, N-acetylcysteine, milk thistle, selenium, vitamin C, and MSM. Other agents are charcoal, zeolite, and clay, such as bentonite clay. The Autoimmune Protocol diet is an elimination diet designed to help reduce inflammation or other symptoms caused by autoimmune disorders. It's comprised of 2 phases designed to help you identify and ultimately avoid the foods that may trigger inflammation and disease-specific symptoms. Elimination of gluten, for example, can be a great help as it can trigger all sorts of immune reactions. There's some who speculate that this is not just due to gluten intolerance or gluten sensitivity, but it's also due to the high amounts of glyphosate, Roundup weed killer, that can be found in wheat and other non-organic foods. Many autoimmune disorders cause muscle and joint pain, which can interfere with sleep. A person's immune system may attack cells involved in sleep processes. Researchers recently determined that narcolepsy, a condition in which people fall asleep suddenly and without intention, is an autoimmune disorder. You can check out my video on herbs to help you sleep for some information on supplements that may help promote a normal circadian day-night sleep rhythm. You should avoid caffeine and stimulants, as they may seem helpful at the time, but they stress out the body in the long term. The two main things for increasing energy in the day are fixing hypothyroidism, such as with nascent iodine and selenium supplementation, or the research chemical SR 9009, which was designed as a cure for jet lag and seems to be one of the only compounds available that makes your body dump old damaged mitochondria. It also has some promising trials showing improvement of many autoimmune conditions, such as IBS and Crohn's disease. Patients with mitochondrial disease can have issues related to the decreased production and function of the body's white blood cells and antibodies that need to be generated to fight infection. You can check out my videos on mitochondrial boosters and on endurance boosters for more information about the mitochondria and its ability to generate ATP, which is adenosine triphosphate, the energy source of the body. As there's at least 80 kinds of autoimmune diseases, be sure to check out my website to see if your condition is covered in one of my videos. For example, the natural treatment and support protocols for multiple sclerosis, chronic fatigue, type 1 diabetes, asthma, Graves' disease, polymyalgia rheumatica, fibromyalgia, rheumatoid arthritis, and psoriasis have already been covered and uploaded by me.